Clinical trials are done in humans. Okay? Before a drug, let me example with a drug. Before a drug comes for a clinical trial, it has to be shown to be effective first in the laboratory, okay, in test tubes and petri dishes. Then they have to show in animal studies that it is safe, and there are strict criteria. You must do it in 2 different strains of animals, extensive toxicology studies. Only after everything is done, then it is considered suitable to be tried in human beings. Right? And in human beings, we have various phases of clinical trials. The first phase is called a phase 1 trial, which is done in normal human volunteers. So someone brings out a drug for TB, we don't straight away test it for TB patients. We first test it in normal volunteers to show whether this drug is safe or not. When we test it in normal volunteers, we cannot say anything about whether it is effective or not, isn't it? Because a normal person doesn't have the disease. So the aim of a phase 1 study is safety. Okay? So we ask for volunteers for this study. We explain this and ask, are you willing to be a part of this study? And then we very closely monitor them. We test every body function. We test the heart by doing an ECG. We do the blood test to see whether it is affecting the kidneys or the liver. So extensive tests are done, and they are followed up over a period of weeks in a number of patients. This is phase 1 study. The phase 1 study, if it shows that this drug is safe, okay, it doesn't have major side effects. Sometimes there may be minor side effects like a headache or nausea or something like that. So we balance and say, yeah, is this side effect worth compared to the benefit you're going to get? So you might say, yeah, it's worth it. Okay, every drug ultimately will have some side effect. No drug is 100% safe. But the process, the drug is affecting the kidney, okay, then that drug will fail. It will not go to phase 2. So phase 1 will establish whether this drug is safe in human beings by testing it in normal volunteers. Then the next to it is phase 2. Phase 2 is done in patients. So if someone comes out with a diabetes drug, it is done in a diabetic patient. Someone comes with a malaria drug, it's done in a patient with malaria. A TB drug is tested in a patient with TB. But this is a preliminary stage. So we try to see, okay, we have shown it is safe in normal people, but is it effective? It may be safe, but it has to kill the bacteria. So we take a small number of TB patients, give this drug, and try to see whether it is killing the bacteria. And we also look at the safety. Okay? Just because it is safe in a normal person doesn't mean it is safe in a TB patient. Because a patient with TB has a disease, it may be affecting his organs, right? A patient with TB's liver may not be the same as a normal person's liver. So in addition to whether it is efficacy is good, we also look at the safety. And then if we show, yes, this drug is killing bacteria, this drug is safe, then we go to a phase 3 study.